on, and turning again to the royal health cares which emerged earlier this week, from the Princess of Wales, who remains in hospital following abdominal surgery, to the King, who is set to face surgery for an enlarged prostate.
Well, one thing which has been noted is the eerie silence from the Sussexes. No public statement over the royal medical dramas. Why might that be? Let's talk to GB News royal correspondent Cameron Walker. A silence, what can we take from that?
Well, we know that relations aren't great, don't we, between the working royals and Harry and Meghan. I think I must stress that we haven't heard any statement from any members of the royal family, including Harry and Meghan, regarding the health of the Princess of Wales and indeed the King. But there is a serious issue here, and that is that we have three senior members of the royal family effectively out of action, because one's in hospital, one's going into hospital next week, and the other one is looking after his wife. So that just leaves Queen Camilla and, let's say, the junior working members of the royal family. Now, there's this thing called a Councillor of State, whose role it is to deputise on behalf of King Charles if he is ill, i.e. if he goes into hospital and cannot carry out his duties. Now, usually that is the monarch's spouse, and that's Camilla, and the four most senior members of the royal family in the line of succession over the age of 21, unless you're heir apparent, in which case you have to be over the age of 18. So as it stands in law, that is Prince Harry, followed by, there's the Queen, followed by Prince William even, followed then by Prince Harry, then Prince Andrew, and then his daughter, Princess Beatrice. But in 2022, the King was quite cunning and clever, because he asked that two more names can be added to that list, and that's his two working siblings, Princess Anne and Prince Edward. So even if the King was incapacitated and couldn't carry out his duties, then it's incredibly unlikely that both Prince Harry or indeed disgraced Prince Andrew would have to carry out duties on his behalf. Although I have been assured that the King is not needing a deputy, or not needing Councillor of State to deputise on his behalf when he goes into hospital next week. He can still carry out his duties behind the scenes, going through his red boxes, signing official documents, etc. But we're not going to see him in public.
Do you think it's a fair criticism to Prince Harry and Meghan that they haven't made some kind of public statement? There were reports that perhaps Prince Harry didn't hear about the various health scares from the royal family themselves. Rather, he may have found out from the media.
Well, it wouldn't surprise me if that was the case. We understand that Prince William and Prince Harry are not on speaking terms. He rarely speaks to the King, although I do know that he did speak to the King on his 75th birthday back in November. But Prince Harry himself says in his memoir Spare that he found out that the late Queen died via a BBC News alert, although sources in the palace, according to many biographies and reports, were desperately trying to get hold of him. The reason they couldn't get hold of him is because he was on a flight on his way to Scotland. So it wouldn't surprise me if he found out about the King's ailment and indeed the Princess of Wales via the media. He may well have contacted them privately. We don't know. I suspect we're not going to get that information. But in terms of a public statement, we haven't had any public statements from any members of the royal family, apart from the Queen yesterday in Aberdeen, where she said her husband, the King, was fine and looking forward to getting back to work.
Well, thank you very much indeed for bringing us that. Cameron Walker, our royal correspondent, the very latest on the two health scares in the royal family.
And indeed the animosity between former senior royal members and current senior royals.
A little statement might be nice. Just saying our thoughts, for a speedy recovery